And what can you do right now to prevent the cancer that you fear most? Today, the answers to those questions, and they may just save your life.
You have breast cancer.
4 words that can change my life
in a single moment.
While you watch this show, 23 more women will be diagnosed with breast cancer.
Breast cancer is the most common cancer in women. No matter your race or ethnicity,
every 69 seconds.
a woman dies from breast cancer.
I didn't know any of this, and neither did my doctor.
This is not a silent killer. There are warning signs. But the road to knowing and reducing your risk for breast cancer is filled with confusion.
I have yearly mammograms, but should I be doing something else?
I'm stressed out all the time. Does stress lead to breast cancer?
What age does my daughter have to get a mammogram?
I have a family history of breast cancer. Should I be concerned?
Do you have to check one breast more than the other?
I read one thing and then my doctor says the opposite.
I need to know the facts. We just need clarity.
You have a voice. You need answers.
Is what you don't know about breast cancer putting you at risk? Today, we're going to end the confusion and explain exactly what you can do to protect yourself. You don't have to be a victim of breast cancer. Now, I'm going to ask a few members of the audience, if you don't mind, who will volunteer to talk to me about this. Mary, you want to start? Sure. So if I can just share some of your story. You were 38 years old when you were diagnosed with breast cancer.
Yes.
Tell me who you thought of first when you got that fateful diagnosis, when you heard those words, you have breast cancer.
I thought about my daughters, my children, and their future. Because at the time, I thought it was a death sentence. But, you know, I've learned that it's, you know, you live with it.
And how'd you tell them the news?
I sat them down and explained to them that I have breast cancer. They didn't know. They didn't understand. Well, the 16-year-old understood, but she was devastated. Yeah. She was devastated.
Thank you for sharing your story.
Thank you.
Melissa's with us also. Melissa, now you've been diagnosed for the second time around.
Second time around.
As having breast cancer. So explain to me what it's like to have that diagnosis and talk to me about screening for it.
I tried to always do all of the screening. My mother had breast cancer twice, so I was very aware of it my whole life. My first intervention as far as having any kind of finding any diagnosis was I had an open biopsy when I was 16.
16 years of age?
16 years of age. At that point, my mother had breast cancer once. My mother, she had it twice, 15 years apart. So I always did all the testing that everybody wanted me to do and was always very diligent. So both times when I had breast cancer, I found it very early. I have been able to catch it. I'm now, my second surgery was just 5 weeks ago today.
And let me ask you, and I hope you do well through this, I know it's too early. Do you feel like screening saved your life?
Absolutely.
Thank you very much and good luck.
Thank you.
Lisa, if you don't mind joining us. How are you, Lisa?
Good, how are you?
So tell me your story.
Well, I do perform self breast examinations. I've been doing that for many years. But last year I felt something very different, just in the quality of what I felt, because I had become very familiar of how they felt. But it was very hard and round, so I quickly went to my doctor to get tested, and he did a biopsy, and that's how I found out that I had breast cancer.
And how have you coped with that?
It was difficult at the time, have tremendous support, but it's really taught me to pay attention to my body, to listen and to be present within what's going on, and always just to don't ignore the signs and do all the things you can to lower your risk.
Thank you very much,
You're
Lisa.
welcome.
You know, this is the attitude we're going to talk about today. You folks represent the 2.5 million breast cancer survivors. Think about that, 2.5 million people. You know what the odds are that you will survive breast cancer diagnosis? I was shocked by this. I keep on top of this stuff. I didn't realize it. 85% of women diagnosed with breast cancer are still alive 10 years later, which is a big number. So this show is about giving you good news. And I'm doing it because I want you to understand your risks for breast cancer and how to reduce them, because you can be part of that 85%. Now, to help me go through them is Dr. Ruth Oratz. She's a breast oncologist and medical advisor to the Susan G. Komen for the Cure Foundation, the New York chapter. Dr. Oratz, thanks for joining us. Talk to me a little bit, if you can, about why it's so important for women to understand breast cancer, and most importantly, what do they really have to appreciate about this diagnosis?
The most important thing is for a woman to understand what her risk factors are for developing breast cancer.
All right. Most women think the biggest risk factor for breast cancer is family history. We heard a story of that nature. But the most important issue for everyone to understand is it's your exposure to estrogen that matters. Please explain that.
Well, you're absolutely right. Only about 5 or 10% of women with breast cancer have a genetic susceptibility or a strong family history. We now think that estrogen is one of the most powerful risk factors for breast cancer. So it's that exposure to estrogen by the breast tissue that can cause those cancers to start developing.
So I want to give you all a very short list. There are 5 questions that you need to ask yourself about estrogen exposure. Here they are. Did you start menstruating before age 12? Did you have your first child after age 30? Did you bottle feed your children? Did you go into menopause after age 55? And finally, did you have hormone treatments? Like example for getting pregnant or hormone replacement therapy at menopause. Those are the 5 questions. If you said yes to any or all of those questions, it may mean that you've had high exposure to estrogen. So I want to go back and talk to Dorothy. And Dorothy, I know you've looked at these questions. You can, one second. Oh, you actually, I need this. I know that you've been exposed to some of these according to the questions that you've answered.
Yes, I have.
So I've got them in front of us. You remember which ones that you have exposure to?
The first one, did you start menstruating before 12?
Yeah.
And did you have your first child after 30? I had my second child after 30. And I bottle fed my son.
So 3 out of the 5 you check off.
Yes.
Because you've had increased exposure to estrogen. Right. Now, Dr. Orris just finished teaching us a little bit about this. So you were diagnosed with breast cancer at age 50?
Yes.
Did you know that these risk factors had placed you at increased risk for breast cancer because it meant that you'd had more exposure to estrogen in your life?
No, absolutely not. I'm surprised to hear that.
How many of you are also surprised to hear that, as Dorothy is? Yeah, just about everybody. So I'm going to take 2 minutes here and explain to you why it is so vitally important to appreciate this risk factor that we can control. All right, I've got an animation here. Dr. Arts, you can't change that diagnosis, right, of whether or not you got pregnant early or bottle fed. But what factors can you control?
Well, the most important factor that we can control is our weight, is diet. Because we know that being overweight, having more fat cells, actually increases the amount of estrogen in our bodies. Fat cells produce estrogen and they store estrogen. Women who continue to gain weight in adulthood, maybe more than 45 pounds, let's say, have a double risk of getting breast cancer.
Double the risk.
Double the risk.
All right. So we've talked now about estrogen exposure, and now we know that gaining weight is one of the ways we do that. And I talk a lot about this on the show, about the importance of weight gain and what it can cause in your life, including an incidence of breast cancer. But let me show you why this is so important. If you look at an animation and you look at the fat we may have around our waist, no matter how much it is, hormones from there go up to your breast. And let's talk about the breast for a second. That's a cancer cell right there. And there are cells around that are normal cells. And that cancer cell will begin to squeeze them out of the way and push them. And now our immune system will send an immune cell to kill that cancer cell and cart it away. That's what's normally happening inside of our body. But if you have too much estrogen in your body, for example, because you've got some belly fat that you don't want to have, instead of this happening where an immune cell comes and cleans up your breast and leaves it the way it's supposed to be, this is what starts to happen. Let's move the animation forward. There's a blood vessel there. The blood vessel will start secreting estrogen and other chemicals. The cancer cells now won't stop at 1 or 2. The immune system can come in. That flourishing cancer cell will begin to grow. It'll bring new blood vessels into it. It'll start to get larger until it finally gets to a spot on your breast where it might become palpable, or if you get a mammogram, where you may be able to see it. That's one of the reasons that we focus on things you can't control. Dorothy, you can control some of the risk factors for estrogen. You can't control other ones. Dr. Orris, talk to us a little bit about breast cancer and the density of the breast.
Well, dense breast tissue, we now think, is related to that estrogen story. The more estrogen that's around, the denser the breast tissue is. That may make it a little more difficult to see a cancer on the mammogram. But it also may mean that the breast tissue is more at risk for developing a cancer.
Did you know that before?
No.
Now, this is one of the big misperceptions. Here are 2 breasts. Go ahead and examine those. You can use both your hands. And try to compare them and tell me which one you think is the denser breast. And just describe them to everybody if you don't mind.
I feel like sand in a bag that you're trying to push around. Yeah.
Is there a difference?
This one feels a little less dense, maybe.
You would think.
A little more squishy.
You would think. It was natural to think that by simply touching your breasts, you could figure out if they're dense or not.
Right.
Right? That makes sense. Turns out, you can't. You can't. Dr. Oratz, how can women tell if they have dense breasts?
The only way to really know if you have dense breasts is with an X-ray, a mammogram.
And
You can see, here's an example. So the very dense tissue on the mammogram looks all white, and we can not really see through that. There might be a little cancer hiding in there. Whereas a breast that's not dense, we call that fatty, looks very clear, and it's much easier to detect an abnormality there.
So, Dr. Oratz, so while we're on this topic, there's been a big debate about the age at which women should start getting their mammography. Many organizations say age 40. A lot of doctors think that age 50 might be the right age. Give us some advice on this. I mean, you're a world expert in this space.
Well, we do think that women should start having screening mammograms at age 40. That's very important. And maybe if you have some of these increased risk factors, maybe start a little bit earlier. As we're learning more and more about breast cancer, we may start seeing a shift in those recommendations. So women who have a lower risk may be able to start a little bit later or go a little bit less frequently. So we're trying to figure that all out.
You know, it's a law in some states now that you have to be told this. But for everybody out there, in most of the country, that's not the case. Please ask your doctors. Once you know that, it changes it. Let's talk a tiny bit about it. Thank you very much. So once you know you have dense breasts, what's the next thing you need to do? It's to find out about newer screening tests. And Joanna's joining us. How are you, Joanne?
Nice to meet you both.
Thanks for being with us.
Having me. Thanks for having me.
So come on over here. Let me talk to you about it. Do you know if your breasts are dense or not?
Unfortunately, they were, yes.
They are. So you had mammography. They told you that. And how have they been screening your breasts because they're dense?
Well, let me step back a bit. I felt doing all the right things, eating right, exercising, never missing a doctor's appointment, felt a lump during a self-exam, and went for a mammogram and sonogram that day. On the mammogram that day, I went in, did the exam, the tech left the room, came back in and said, okay, you're all clear, you can get dressed. And I just assumed she'd come back into the wrong room. And I said, oh no, I'm the lady with the lump I can feel. And she said, oh no, you have dense breasts. It's unlikely, that would be a very difficult find for us, is what she told me. And I remember saying to her, wait, what? That was the first time I had heard the term breast density. And of course it was picked up, 10 minutes later I had the sonogram, it was picked up. So the first day I heard that term was the day I was diagnosed with breast cancer.
Oh my goodness. So Dr. Oratz, help us understand this better. What should women do if they do have dense breasts? Talk about some of the newer imaging techniques.
Well, we've heard about one of them, which is ultrasound or sonography, and that's very helpful if the breast tissue is dense, and MRI can also be helpful. But there's a new test that's just recently been approved by the FDA. It's called digital tomosynthesis, and this actually takes a three-dimensional picture of the breast, and with these little slices, the computer then creates a three-dimensional image, and we can really see tiny little abnormalities in the breast tissue. It's a very exciting new technology.
So again, this is an animation of that, but this gives us an ability to see things we couldn't see before. So for the many women who have dense breasts, at least it can move us along on the path to making the right diagnosis. Good luck to you.
Thank you so much.
Thank you. All right, let's move on from the most sophisticated tests to the most basic one. Welcome, how are you?
Hi.
And you've got to make sure that you know your risks of breast cancer. So in order to do that, you have to make sure that you don't ignore your self-exams.
Yes.
All right, what's your first name?
Kelly.
Hi, Kelly. Tell me your story.
Earlier this year, I was a young nursing mother, found a lump myself while reading to my daughter, had follow-up testing, mammograms, ultrasound. Turned out I had breast cancer, but it was very evident that it had spread to my lymph nodes, which were huge, actually bigger than the lump that I found. And that's something people
just so I can understand this better, you felt the lymph node mass at the same time you felt the breast cancer mass?
No, I felt the breast cancer mass, and then the doctor pointed out the lymph node mass, which I didn't even know to look for. I wish I had. I might have found it a little sooner before it had been, gotten to my lymph nodes.
Dr. Oratz, help us understand this a little bit better. The self-exam issue has been controversial as well. Women should do it, I gather.
They should absolutely do it, and especially young women, because they may not be going in for screening. So, and we've heard that from, I think Lisa told us, that self-examination is absolutely the way that I see women present with breast cancer all the time. Now, when you're doing that self-examination, as we're hearing, you need to not only examine the breast, but know that breast tissue goes, I'm going to show you, it goes all the way up, just to under the armpit, that's breast tissue still all the way up, and then these lymph nodes up here in the armpit can be draining a cancer from the breast, and sometimes the lymph nodes get swollen and form a mass even before you might notice a lump in the breast.
So listen, it's not just about examining your breasts. It's also about looking at your breasts. Look in the mirror. If you notice any changes in how the skin looks, any bumpiness, sometimes it'll look like a rash, change in texture, if the shape has been altered from what your normal is, because you know your breasts better than anybody does. If that's the case, then at least you can make the diagnosis. All right, so the good news is that breast cancer can be beaten, especially if you find it early. So log on to DrOz.com to get the Susan G. Komen for the Cure Breast Self-Awareness Card. It'll help you get what you need to know in order to figure out what's normal for you and what's not. I want to thank Dr. Oratz very, very much for your sage advice. And all my guests. Coming up next, the most important foods to fight breast cancer.